I'm Dr. Amie Bend, and I'm demonstrating some stretches for the lower back today. This is one of my devices that I sell to my practice, my patients, and it's utilized for your spine, for your neck posture. It's called a dental roll. This is a cervical dental roll. But in this illustration, I'm actually not using it for its real purpose. I'm actually using it for another purpose. There's a little ridge on the top of it. And it's great to do a trigger point release on your lower back if you're sore. So you can also use a tennis ball if you have one. I just don't happen to have a tennis ball available right now, so I'm going to use this. I used this on the weekend when my back was hurting, and it really provided a great deal of relief for me. So what you do is you basically lie on your back, and you're going to put this underneath your gluteal muscle, right near where your piriformis would fit. And you're just going to lie and open your leg into an extended position, and you're going to just lie it on the back of the bottom and try to do some trigger releasing with it. And you can position it exactly where you're feeling tension, like you would an exercise ball, and just rest it there. Okay, and you may only need to do this on one side depending on if you're having a sore back. So you'll find an area typically when you're real sore, you'll know, okay, this is where I'm sore at, and this is where it feels good to release my spine. So on my left side, I'm pretty good. My right side has more pain, so I'm going to switch legs and straighten out the bottom leg, the left leg, and then use the right leg. And you can just put it on your different trigger areas, your piriformis muscle. You can maneuver it around and just find where your triggers are and just lie it on the trigger. And I found one on the right side. I didn't really feel a lot of pain on the left. And this can be very effective if you're having a lower back pain or what some people consider sciatic pain. So you could just lie on the area where the muscle's tight and just rest there for 20 seconds to a minute, depending on how tight you are. So I'm not very tight today, so I don't have a lot of symptoms or a lot of trigger points. But on days, for instance, the weekend, I had a lot more trigger points, and I found one particular spot that was very tight, and I just lied on it with my body weight, and I felt better after the release. So this is a great way for you to use your dental roll in more than one way. So anyway, I'm Dr. Amie Bend. If you have any questions, give me a call. Also remember, you can just use a trigger point ball or tennis ball in this instead. This is just something that I had that I could use. I was already lying on my dental roll, so I just used it as some trigger point work for myself as well. I'm Dr. Amie Bend. Give me a call if you have any questions about this exercise or any other low back exercises. Thank you.